everybody. I'm Gail Lee, the president of the board of Aging Advantage, and Aging Advantage is a nonprofit here in St. Louis area, and we're committed to care for all and try to bring these education presentations to you in regards to all kinds of topics that can help you as a caregiver. We're not-for-profit agency, and we help the elderly and disabled in the area with all kinds of informational case management, and we're trying to help support the caregivers. And we have a really good presentation today, and I'm going to let Rachel, one of our care managers, introduce our speaker, and she'll tell you about different revolutionary things that are going on with our mental health.
Hello, my name is Rachel, and I'm here to introduce Dr. Erica Buchalter, and she's going to be speaking today on MRT therapy and revolutionizing mental health through neural optimization.
Well, Rachel, Gail, thank you so much for having me. Again, I'm Dr. Buchalter. I'm a psychiatrist here in St. Louis and have a private practice called the Insync Brain, where we improve brain health and brain efficiency and how the neurons talk to each other. And I'm excited to be able to share that with you today. So again, I'm the owner here at the Insync Brain. It is the only clinic in St. Louis that offers MeRT treatment. There are 100 clinics throughout the world who provide this care as well. And then they're seeking 501(k) clearance as a medical device, but it's not currently cleared for any indications by the FDA. We'll talk more about that, but I think it's important to have those disclosures up front. So today I'm really excited to talk about MeRT, magnetic resonance therapy, and how it differs from traditional mental health treatments as a really innovative, personalized approach. We'll talk about how it can be used for depression, PTSD, autism, and traumatic brain injury, and also explain the role and how to refer patients over or who would be appropriate for treatment. So we think of the brain, and the brain has all these neurons that are firing and talking to each other. And they use energy in order to do that, to make these connections. And one quote I really like is, neurons that fire together, wire together. So the whole idea behind MeRT is we're getting all the neurons to fire at the same time and at the same speed to improve that communication and efficient communication within between the neurons and within the brain. So MeRT is an innovative technology that brings together two different procedures into one to personalize treatment. So the first thing we do is we get an EEG recording. An EEG puts electrodes over the brain and gets the speed of those neurons. It takes and it records how the neurons are firing and the energy between them. We then use the MeRT software to analyze this 10-minute or 15-minute recording to really get a good sense of how the brain is working. And then from that, we can develop an individualized protocol to use TMS, or transcranial magnetic stimulation. And TMS uses a magnet to train all the neurons to fire at the same time. So going into a little bit more detail about each of these steps, an EEG, it's used, people are mainly familiar with it because that's what's used to detect seizure activity and to see if the brain is having any seizure activity. So it measures and records the electrical activity between the neurons, and we can use it to assess how well the brain is functioning. We do the recording for about 10 minutes, and we get that recording with eyes closed, typically in a dimly lit room, and we have you do rote tasks, maybe running through your grocery list or doing multiplication tables or thinking about a grocery store and each of the places you go within it. I'll talk more about that and why we do that later. And then we also get your heart rate, and we use the heart rate variability for part of this as well. That second step is the protocol generation. And so we get a neurosynchrony report that is an individualized EEG. It takes all that data and puts it into one format in an easy to read report. And it allows us to create that personalized protocol so that we can target the brain and use this personalized TMS therapy. And so with that, transcranial magnetic stimulation is FDA approved to treat treatment-resistant depression and has been used for 15 or so years in that capacity. With that, though, we're taking and creating a new protocol and an individualized protocol for each person who's getting treatment. So taking a step back to sort of put this all into perspective. If you think about the heart is an electrical organ. The brain also is an electrical organ. And in the heart, you have a pulse that starts at the AV node, and it causes the heart to contract and push blood through the body. And your heart rate can differ depending on if you're asleep when it's much lower, or if you're out running and exercising, your heart rate or the speed of your heart is much faster. Similarly, the brain operates at different speeds. So we have delta, which is your deep sleep, and that's the slowest speed. We then have theta, which is slightly faster. That's either in light sleep. People can get into theta activity in deep meditation or deep relaxation. And it also is our creative speed. Alpha, which is our eyes closed resting state. And again, I mentioned earlier, we do the EEG recording with eyes closed. That allows us to get as much alpha activity as possible and see how much of your brain is in alpha. That's sort of our resting state, our choice state. From there, we can make movement. And then beta is eyes open, awake. That's your problem-solving state and your active engagement. So this on the right side, this is what a typical EEG would look like. We have the front of the brain. Oh, I apologize for that. We have the front of the brain up top, the center of the brain in between, and the bottom of the posterior brain, the back of the brain on the bottom. And what we expect to see is that we'd have this nice alpha peak. So this is divided into 4 regions. You have delta on the far left, theta, which is slightly faster, alpha is this light blue, and beta is sort of this gray color. And we would expect with a 10-minute eyes closed EEG to have mostly activity in this alpha range. And we see here a nice alpha peak in the posterior region, which is where the electrode pulse typically originates, and then it moves forward. And we see that alpha peak in the center and the front of the brain as well. It's nice and coherent. It's at the same speed in all 3 regions. So different psychiatric concerns and illnesses have different EEG patterns. These are some examples. For example, not everyone with depression will have an EEG pattern that looks exactly like this. Autism is one where pretty much everyone with autism has a pretty similar pattern. But these are some examples of how the brain patterns differ depending on what insult has occurred to the brain. So this one on the far left is a more typical EEG, and that's what I showed you initially, where you in alpha, you have a nice consistent peak that's coherent in all 3 regions, and the brain's firing at the same time and the same speed. This next one is after a concussion. You can see their brain speed here, but even centrally and posterior, their alpha isn't aligned with what's happening in the back of the brain. And they have a lot of slowing down. And so it's because the brain was jolted and they had this a lot of the neurons started firing at different speeds. In something like addiction or opiate use or other substance use, you also have this slowing down of the brain. A lot of people actually refer to addiction and substance use as a chemical traumatic injury to the brain. We typically see this slowing down similar to concussion. Autism, which is a developmental disorder, is really interesting in that an alpha peak never really develops. And with MeRT, we can use this technology to help create and build an alpha peak. We'll talk more about that. PTSD, this is an example where you have sort of two peaks and a really broad peak in the central and the frontal region. And then this is one with depression where there happens to be a lot of slow activity. Again, especially depression, because it's so heterogeneous, can look like a lot of different things on EEG. So I want to start off talking more about depression. And the reason for that is TMS, or transcranial magnetic stimulation, can be used for depression as well. So with depression and TMS, everyone's treated with the exact same protocol. Everyone's treated at the left dorsolateral prefrontal cortex. Everyone's treated at 120% motor threshold. So motor threshold is sort of like a reflex where you stimulate the motor cortex, and on the other side of the body, on the hand, you would see a movement in the fingers. And you can get each individual's threshold for how much power it takes to stimulate the brain in that way. And so it treats at 120%, and everyone is treated at 10 hertz. MeRT typically treats on the forehead at the FPZ location. You can also treat at PZ as well, especially in something like autism. Because we're being so much more precise with our brain speed, we don't need to treat at as high of a power. So we treat anywhere from 60 to 80% motor threshold. So it's not as loud of a treatment. It doesn't necessarily stimulate the forehead as much. Sometimes TMS can be a little bit painful. If you've ever had a TENS treatment where they stimulate the muscles, it feels sort of like that. And the more power, the more discomfort there is. And again, that brain speed is personalized for each individual. Going back to explain that a little bit more on the brain speed. So if you look at this here, this line here is 10 hertz. And so this peak is around 11 hertz. So if this patient were getting optimization, we would treat them at 11 hertz. Whereas this one here, their innate brain speed is at 10 hertz. And so we'd go ahead and treat them around 10 hertz. And something here, for example, also in this PTSD example, theirs is around 10 hertz. So we're individualizing that speed depending on the EEG. MeRT is used pretty widely in PTSD. This is a paper that showed statistical significance in depression, PTSD, and other deficits. And 67% of subjects said that they felt like they had clinically meaningful improvement in their PTSD symptoms. And 43% of those patients went into remission. And I think that's really exciting, especially when we're thinking about military or other people who have these pretty life-altering symptoms that are affected by that affect their life and their day-to-day function, to be able to have this degree of improvement in their day-to-day symptoms. What's also really exciting is the FDA gave MeRT a breakthrough device designation. And so currently there's a large clinical trial going on for PTSD. It's through Texas A&M, and there's also 5 other sites in the trial. And with that trial, the FDA is saying, hey, this sounds really promising. The research isn't there where we can take and say that we're giving clearance to this treatment, but we think that it's moving in that direction. So we're going to give you a priority review. We're going to help streamline the approval process and improve access for patients. so that it has to go through all the normal steps of a clinical trial, but it sort of speeds it up or makes it align better so that we can get this treatment to patients more easily. Another diagnosis that responds really well to MeRT is autism. Earlier, I took and I said that in autism is a developmental disorder. For some reason, that alpha wave and that speed doesn't develop. Or if it develops posteriorly, it doesn't develop frontally. And we can use MeRT to connect the back of the brain and the front of the brain. This is a study that's out of Australia, and they used the CARS, which is a specific autism rating scale, as well as the pediatric quality of life inventory. And what they found was that there was significant improvement in emotional, social, and fear or nervousness. The other thing that they found really improved, and they're doing a follow-up study, was parents' quality of life significantly improved, as well as sleep. And in clinic, we see similar things, that significant improvement for patients. So this is an example of someone we treated with autism. You can see they have this nice posterior peak to start off with, and they also had some centrally, but frontally, it's just a downward curve. They don't have an alpha peak in the frontal region. With treatment, not only did their posterior and central peak improve, but we were able to build up an alpha peak for them. And what their family said, the biggest improvement was in anxiety and hypervigilance. They were no longer running around, they were no longer eloping, they were able to walk around a store with their parents without running off. And some other things that improved was quality of sleep at night and engagement in speech and occupational therapy. So just much more engaged at school. This school year, there haven't been any reports of behavior, whereas last year there were multiple every week. And so this kiddo is just doing great, and the family just feels calmer, and there's less noise and less activity, which has made a huge difference in their ability to go to activities, even things as simple as going to the grocery store. This is an example of someone who had a traumatic brain injury or a concussion. We can see their intrinsic speed here around 9 Hertz, with all of this slowing after their concussion. And with treatment, over time, they built up their alpha peak, and that slow activity significantly decreased. And that's what attributes to this improvement in symptoms. The brain's no longer talking at 2 different speeds. It's able to speak at a single speed. And so that scatteredness feeling, or on edge, or constantly looking over your shoulder because you're not sure what to expect, those symptoms decrease as the brain's talking more efficiently. Becca Speak is a professional surfer who had multiple traumatic brain injuries. She completed EEG-guided TMS, as well as some additional therapies like hyperbaric oxygen and physical rehabilitation. And she has recorded, you can find her on TikTok. She's recorded videos pre and post treatment and as she's gone through, and her speech and ability to speak fluently significantly improved with treatment. I think it's important to talk through some of the safety and side effects and who can be treated successfully. So the EEG itself, there are no reported side effects. Some people, we put gel in the hair in order to create that electrical current. And so that can be an irritant for some patients, but nothing significant. With TMS, like I said, the treatment feels like a TENS unit with a stimulation. And so some people can find some temporary discomfort with that. Some people get a headache with treatment. Typically that seems to be due to needing to eat more food. So for example, we're sending MeRT is a workout for the brain. Just like you're going to the gym, you're using tons of energy and sending all that energy and sugar to the brain in order to rebuild these neural networks. And so some people will get a headache or get really tired with treatment. And we find having a snack and making sure you're getting adequate nutrition decreases those symptoms. Some people become a little overstimulated or excited. It can impact sleep, especially if we do it too late at night. Again, we're sending so much energy to the brain, and we manage that by decreasing the power, but also that typically improves after that first week or so of treatment. And there is a risk of seizure. It's 7 in 100,000 or so. We are doing that EEG before treatment, so we can see if there's any seizure activity. And then we're doing repeat EEGs throughout. So we're able to see if there's anything developing. That's one of the benefits over TMS. Again, that risk of seizure would be there with TMS, but you don't have the EEG beforehand to see if you're someone who's at increased risk of having a seizure. And also that risk of seizure is actually less than the risk of playing video games. So because we're using this magnet on the head, we need to be really careful of any metal in the head. So anyone who has a steel shunt or a stent in their cranium, any metal fragments, for example, shrapnel, cochlear implants or aneurysm clips, anyone who has brain cancer or lesions to the brain, metastatic lesions. And then there's some magnetic dental implants where you wouldn't be able to do treatment, and any type of ocular implant, not cataract surgery, but an actual implant. Someone who has a seizure disorder, if it's well managed, we can continue with treatment. We would just decrease the power to decrease the risk of having another seizure. And similarly, bipolar disorder or schizophrenia, sending that much energy to the brain could induce mania or something similar. And so we're just more cautious with those. We also just need to be more cautious with the magnet placement for if someone has a stimulator or a vagal nerve stimulator or spinal cord stimulator, hearing aids and pacemakers. Those are all things we're just cautious with. If someone has eyebrows that have a magnetic ink, tattooed eyebrows, those could warm up with treatment, so we'd be really cautious. And anyone who's pregnant or breastfeeding, we take additional precautions. So treatment itself, the length of it is really dependent on the severity and the disruption that we see on the EEG. So typically, patients do 6 weeks of treatment divided into 2-week segments. So we'd have our initial EEG and a clinical evaluation, do 2 weeks of personalized TMS therapy, another EEG and follow-up, and then do 2 weeks of treatment. Every 2 weeks, again, we do that EEG and an EEG at the end of treatment. And this allows us to continually update the protocol as needed. During treatment, it's really important to pay attention to sleep, especially because at night, that's when the brain is creating new networks and new neural connections and improving that efficiency of the brain. We also ask patients to really pay attention to nutrition and exercise and connection with others and building that connection with others. And paying attention to all these things will improve durability of treatment over time. Because it is a daily treatment for 6 weeks, some people opt to hold their psychotherapy, their OT, PT, speech, other ABA or other therapies, just because of the time commitment. But then once they return, especially kids with autism, they're better able to engage in all of those therapies and get more out of the therapy that they're attending. And people feel similarly with psychotherapy. I have one patient with PTSD who got more out of 2 therapy sessions after her course of MeRT than she had in 2 years, because she was less hypervigilant and better able to be present during the therapy session itself. So I know that was a lot of information and a lot of new information probably for most of the people here. I'm really excited that I was able to share this technology and this process with you. If anyone is interested in coming in and getting an EEG and consultation, we'd be happy to see you. You can use the coupon code AGING150 and that'll decrease the cost for the EEG and the assessment. And so it'll be $150. But also, if you just want to learn more about it and book a discovery call or have more questions, we'd be happy to talk with you. So with that, if there are any questions, I'd be happy to discuss. Well, I really appreciate everyone being here, and I'm so glad. Oh, hi, Rachel. I'm so glad that I was able to present.
Thank you. We really appreciate it.
Yeah, I'm just wondering if we have any questions.
What does the price, like, what does it cost per treatment after like the initial assessment? Is that something that like you can work with insurance on or no?
Yeah, that's a great question. So since TMS is FDA approved for treatment-resistant depression, most insurances will cover TMS, and we can generally write in a way where they cover MeRT and this personalized TMS as well. At this time, we're not in network with any insurance companies, but can provide that super bill and all the notes. Because it's not yet approved for other conditions, insurance doesn't pay. And so it is an out-of-pocket expense. For 2 weeks of treatment, it's $4,000. And the full 6 weeks of treatment would be $12,000. That being said, if patients or families do have questions about that, we'd be happy to talk through individual circumstances and what people have going on.
Of course. Thank you.
When do you think that it might be covered by the insurance a little bit more with you being in network?
Yeah, with me being in network for treatment-resistant depression or for other diagnoses?
For any of the diagnoses, yeah, can
Yeah,
treat.
so for example, technically, TMS is approved for obsessive compulsive disorder. Some insurances cover it, some don't. It really depends on the plan. With this big PTSD study, I'm hoping that there's further FDA approval and clearance so that TMS and MeRT will continue to gain insurance coverage. We do typically see a lag with commercial insurance where they don't cover it, even if it's immediately after FDA approval. But that's something I'm excited for. Missouri, we are lucky where we're in a state where there is some funding for veterans and first responders to get treatment covered. And so if anyone falls into that category, please reach out. We'd be happy to connect you with the group who helps fund for veterans and first responders.
Yeah, how was the veteran how was that? I remember you talking about that before, but they go through the VA.
It's not through the VA. There's a group called ETMS Missouri, and we would connect you through them for treatment. And through that, there are different subsidies and other grants available for veterans and first responders. And it goes through the ETMS Missouri group.
Yeah, that's really it's it's really neat when these things come up and then people look at the cost and they're like, oh my goodness. But that happens with everything, I think, at first. And, then it starts to work and insurance starts to get on board. And I think people need to be aware of it. It's really seems like it's making a big difference for a lot of people.
Yeah, I agree. And I hope that over time, and the more people that know about it, and we can advocate for coverage for autism, for example, through the Department of Mental Health, or continued advocacy for PTSD, that insurance and government and other places will cover treatment, because it's unfortunate that cost is a barrier to access care sometimes, especially when it is such an amazing avenue to pursue when other things haven't worked.
Yeah. Yeah, that's what, a big reason we wanted to do, this presentation, because like especially for our nonprofit people, this is probably out of their, price range, but people need to, really be aware of this technology so that, they can kind of watch and see as it progresses and that there is new ways to you know, get this care. And especially, there is veterans and first responders, and as they're getting it and, taking an avail of the grant money, then seeing the differences. Hopefully the insurance will start covering things sooner.
I agree. I hope so.
Did you think of any other questions, Rachel, you might have?
I think that's all. That was the only other question I had.
I have a question. Dr. Buchalter, is there any particular reason why, if someone was in need of better, let's say, treatment or more effective treatment for depression, other than the medical disqualifiers that you mentioned, that people should consider? So, yeah.
One of the reasons I would recommend MeRT over TMS for treatment-resistant depression, especially if there isn't improvement, is because TMS treats everyone at 10 hertz. So if you're someone whose brain operates at, say, 11.5 hertz, TMS actually slows down your brain speed. And I have a patient I'm treating currently who had TMS and maybe had a little improvement, but really felt really slowed with it and almost felt worse. She said maybe concentration improved slightly, but like overall, she felt worse. And she completed 6 weeks of treatment at, I think it's 11.4 hertz, which is her innate brain speed. And she feels much better now than when she did traditional TMS.
Thank you.
For our guests that are on the program, did you, I know you just had that question, but did you find this interesting and helpful?
I think it's very interesting. And I think that the key, as you mentioned, is to get more of the public educated that this type of treatment exists and is helpful and is relatively short term in terms of getting relief from some of these very serious conditions.
Right. Okay. Well, thank you so much. Whoops. Yeah, thank you so much, Dr. Erica. We really, really appreciate your time and people. This will be on our Facebook page and people watch it. And I think you had your slide. Did you want to go back to that one about how people can contact you?
Give me just a sec.
And again, always on our Facebook page, it has all our upcoming presentations, and they're live and usually moved over to our YouTube channel too. So this will be available for people to continue to watch for quite a long time. You can kind of point people there if you want someone to see an overview. And there you go. Your contact information. You can go to the website and book an appointment and get an evaluation or get some information on the program. So again, we appreciate you so much.
Well, thank you so much for having me. I really enjoyed presenting.
Thanks.
Take care.